back. We're still here with Dr. Oz, and now it's time for him to answer some of your medical questions. This is Ask Dr. Oz.
Woohoo! All right, Dr. Oz, are you ready?
Take it away. I'm here.
Okay, great. Our first question is from Casey, who sent in a video. Let's check it out.
Aloha, ladies of the real. My name is Casey, and I'm 22 years old from Hawaii. Last year, after waiting many months to get an appointment in with my OBGYN, I was diagnosed in October with PCOS. And today, my question for Dr. Oz is, what is the impact of PCOS on my fertility? And what can I personally do to lessen the symptoms of PCOS? Mahalo!
Mahalo. Oh, Dr. Oz, that's such a good question. What can you tell us about PCOS?
So it stands for polycystic ovarian syndrome, and it does involve little cysts forming in your ovaries. But the reason it's important is it affects about 1 in 10 women of childbearing age. It's about 5 million women. And what happens is it messes up with your ability to have normal menstrual cycles and ovulate eggs, which is, by the way, one of the symptoms you have is infertility. And the unfortunate reality is people don't realize they have it, so they don't get it treated, and they have trouble having babies. So the hormonal imbalance that causes these cysts on your ovaries interferes with a lot of factors. And because you have PCOS, you'll gain hair on parts of your body that you don't want. You'll actually gain weight that's not your fault, that if you could deal with the hormones, you'd be able to lose that weight. And it's one of the most common and treatable causes of infertility. So if you got hair on your chin, hair in weird places, if you're gaining weight, acne, if you're having trouble with irregular menstruation, think about this diagnosis.
Wow. Okay. Our next question comes from Renee, who wrote in to say, hi, ladies of the real. I'm 17 years old from San Francisco, California. I'm such a big fan. Thank you, girl. My dad has often told me growing up that breakfast is the most important meal of the day. But as a high school student, mornings are really hectic. I'm not hungry. Dr. Oz, is breakfast really the most important meal of the day? Okay, Dr. Oz, what's the scoop on breakfast?
Well, she's trying to get me to take on her dad. I know what's going on here. So as a father, I want to protect him. So here's the thing. The reason that he's talking about breakfast is because when kids eat breakfast, they do better in school. That's true. Because when kids are in school, they don't have the option of eating a little bit later. But if you can delay your breakfast until you get hungry, which will usually be more like 9 o'clock, 10 o'clock in the morning, especially if you get a little coffee early on to get you going, then you actually are going to be on an intermittent fasting program like we were talking about with our System 21 process. So you want to do that if you can. So I don't force my kids to have breakfast. I just tell them if you don't have a snack that you're allowed to eat in an hour or two, you don't have a choice because you won't focus in. And so much of this, by the way, your earlier question on polycystic ovaries, it's the same program there. If you could eat foods that are anti-inflammatory when you do eat, so basically a Mediterranean diet, the one we know that works the best, then you'll wake up in the morning, you're not going to be hungry. So even if you're 17 years of age, if your parents are giving you good food late at night, you'll probably still not be that hungry in the morning. I don't know if about you guys, but if you eat really late, you normally wake up not well rested because your intestines have to work all night long, and you're hungry.
Very lethargic.
Because your hormones got messed up. So you don't want that.
Right.
Yeah.
So I just want to be clear, for her, it would be have like a light snack if maybe she's hungry before she goes to school. Is that what you're saying?
Well, the best scenario is for her not to have to eat breakfast if she's not hungry, but her teacher should allow her to have an apple, a sandwich, whatever she needs to eat around 9, 10, whenever she gets hungry. That's hard for teachers.
So bring
by age
something with her.
17, they might be flexible, but I'm trying to teach kids to live for life. As soon as she's able to eat when she wants to eat, then she should try to delay her breakfast. The problem with grade school kids is they don't have the flexibility because teachers can't open up the classroom to lunch at 10 o'clock in the morning. And that's why we give kids breakfast for free in America, because we know that when kids eat a breakfast, they'll do better in school because they can focus. Because you can't go till noon and not eat anything. If you don't have breakfast, that may be your only choice.
Right.
Well, I feel like no teachers will have a problem with this instruction because we're all going to say Dr. Oz says we can have our breakfast at 9. So you just gave a permission slip to America. Thank you so much. Dr. Oz, thank you for helping out our Real Fam today. To learn all about the More Black Doctors campaign and scholarship program and System 21, go to droz.com. Also, do not forget to watch The Dr. Oz Show, which airs weekdays nationwide. Check your local listings.